Hi friends, I am Dr. Chandan Mohanty, and in this video I will be telling about measurement of bioavailability. What are the various methods by which bioavailability can be measured? Today we will discuss. This is part 2 of bioavailability. Already I have made a video. In that part 1 of bioavailability, I have discussed regarding the definition, types and objectives of bioavailability. That video link I have given in the description. Also you will get in the I button. This particular topic, measurement of bioavailability, is very much important in terms of exams. I have seen whether B Pharmacy or PharmD, every year this question has come. So this topic is very important. Hope you will like this video. This video will be interesting. So without delaying much, let's start. Bioavailability can be measured by two methods. Number one, pharmacokinetic method. Number two, pharmacodynamic method. Pharmacokinetic method is also called as indirect method and it consists of two subpoints, plasma level data and urine level data. Similarly, pharmacodynamic method is also called as direct method and it consists of again two subpoints, acute pharmacologic response and clinical or therapeutic response. Pharmacokinetic method is also called as indirect method because here in this method either blood sample or urine sample is collected from the human volunteers or patient, and in those blood or urine sample, how much drug is present is being estimated. We need to estimate what is the concentration of a drug in those plasma or in those urine sample. Hence it is called as indirect method because here directly drug response is not observed. We need to take the sample, we need to draw the sample, and in those sample how much drug is there is need to be estimated. Hence it is called as indirect method. But in case of pharmacodynamic method, it is also called as direct method because here in these methods direct drug response is observed. After the drug is given, after the drug is administered, the pharmacologic response or therapeutic response of the drug is being observed. Hence it is called as direct method. So there are two methods. Number one, pharmacokinetic method. Number two, pharmacodynamic method. These are the list of methods: pharmacokinetic method, pharmacodynamic method. In pharmacokinetic method, again two subpoints are there: plasma level time studies and urinary excretion studies. In plasma level time studies, again three components are there. Those are important in the measurement of bioavailability. Those are Cmax, Tmax and AUC. Cmax stands for peak plasma concentration. Tmax stands for time for peak plasma concentration and AUC stands for area under the curve. This graph is for plasma level data, time versus plasma drug concentration. This point is Cmax, this point is Tmax, and this total area under this curve, this total area is AUC, area under the curve. And in urine data, again three components are there. Those are dxu by dt max, tu max and xu infinitive. dxu by dt max is maximum urinary excretion rate. Tu max is time for maximum urinary excretion rate and xu infinitive is cumulative amount of drug excreted in urine. So this graph is for urine data. This graph is plotted versus rate of excretion and mid time collection period. So again this pharmacodynamic method, two subpoints are there: acute pharmacological response and therapeutic response. So all these points one by one we will discuss. In pharmacokinetic method, first is plasma level data. In that, first subpoint is Cmax, means peak plasma concentration. What is this Cmax? Cmax is the maximum concentration of drug in plasma after the oral administration. So if you see this graph, x-axis is time, y-axis is plasma drug concentration. So initially the drug level in the plasma is 0, and slowly this level will increase. The concentration of drug in plasma will increase, then it will decrease to the 0. So this point is called as Cmax, means maximum concentration of drug in plasma. So how it will helpful in measurement of bioavailability? This will indicate rate and extent of drug absorption, both rate and extent of drug absorption. As we know, the bioavailability is nothing but rate and extent of drug absorption. So this Cmax will indicate whether a sufficient amount of drug is absorbed to the systemic circulation or not. How? If this Cmax level is below MEC level, this is the MEC, minimum effective concentration, and this is MTC or MSC, maximum safe concentration or minimum toxic concentration. So if this Cmax level is between this MEC and MSC, then it is therapeutically good, it is therapeutically active, because if this level is below MEC level, below minimum level, then there will not be any drug action. Similarly, if this Cmax point is above MSC point or MTC point, then there will be the toxic effect. So this will indicate whether how much drug is being absorbed, whether sufficient amount of drug is absorbed or not. So this Cmax will indicate both rate and extent of drug absorption, and this value will increase with increase in the dose and increase in the rate of absorption. Next is Tmax. Tmax means time for peak plasma concentration, means how much time it is required to reach Cmax. If a drug is taking 3 hours to reach Cmax, that means the Tmax will be 3 hours. How much the drug is taking to reach Cmax is called as Tmax. And how it will be helpful in measurement of bioavailability? This Tmax will indicate the rate of drug absorption. See here, the rate of drug absorption can be known by this Tmax. How? Tmax, as I told, tells about how much time it is required to reach Cmax. So we will compare two drugs. Suppose the drug A Tmax is 2 hours, drug B Tmax is 4 hours. That means drug A is requiring 2 hours to reach Cmax, drug B is requiring 4 hours to reach Cmax. Then in which case the drug absorption will be rapid? Definitely the drug A, means the drug with Tmax of 2 hours. So this Tmax will indicate the rate of drug absorption. Smaller the value of Tmax, faster will be the drug absorption. So as we know, the bioavailability is rate and extent of drug absorption, and in that Tmax will indicate about the rate of drug absorption. Next, AUC, area under the curve. This AUC means how much the total area under this curve. This total area is called as AUC, area under the curve. How it will helpful in measurement of bioavailability? This will indicate the extent of drug absorption. AUC gives the measure of extent of drug absorption, and it will express the total amount of drug that enters into the systemic circulation. If this area is more, if this AUC is more, then more amount of drug is absorbed. So it will indicate the extent of drug absorption. So Cmax is indicating rate and extent of drug absorption. Tmax is indicating rate of absorption. AUC is indicating extent of absorption. rate and extent of drug absorption is bioavailability. Thus, these Cmax, Tmax and AUC, they will indicate about the rate and extent of drug absorption, means nothing but bioavailability of the drug. These are the formulas to calculate bioavailability after plasma level data, means Cmax, Tmax and AUC. These Cmax, Tmax and AUC, what are these and what are these significance? Regarding that, I have made a video. That video link is given in the description. That video is about pharmacokinetic and pharmacodynamic parameters, and that video link also I have given in the I button. So these two equations are for two types of bioavailability. F is for absolute bioavailability, Fr is for relative bioavailability. Absolute bioavailability formula is AUC oral into dose IV divided by AUC IV into dose oral. Means how much we are getting AUC after oral route will be multiplied with dose of IV route. Then it will be divided with AUC of IV into dose of oral. Because in case of absolute bioavailability, we are comparing the oral route with the IV route. Then in case of FR, relative bioavailability, it can be obtained by multiplying with AUC of tests with the dose of reference divided by AUC of reference into dose of test. Because in case of relative bioavailability, we are seeing the test and reference formulation. So the AUC of test into dose of reference divided by AUC of reference into dose of test, this will give FR or relative bioavailability. So there are two formulas, one is for absolute and one more is for relative bioavailability. After plasma level data, it is urine level data. In that first point is dxu by dt max, means the maximum urine excretion rate. So see this graph is plotted between midpoint of urine collection period and rate of excretion. So this graph is same like plasma data. There this point was Cmax, here this point is dxu by dt max. In plasma data this point was Tmax and here this point is Tu max. So how this dxu by dt max will help us in measurement of bioavailability? So this point is analogous to the Cmax of plasma level data. Means the Cmax of plasma data is exactly same like the dxu by dt max of urine data. There the Cmax was indicating about the rate and extent of drug absorption. Here also this dxu by dt max will indicate about the rate and extent of drug absorption. This value will increase as the rate and the extent of absorption will increase. Next point of urine level data is Tu max. Tu max means the time for maximum urine excretion rate. This Tu max is same like the T max of plasma level data. Means in plasma level data, T max is exactly analogous to the Tu max of urine data. Here this Tu max will indicate about the rate of drug absorption. There in plasma level data, T max was telling about the rate of drug absorption. Here in urine level data, this Tu max will indicate about the rate of drug absorption. And this lower the value of Tu max, faster will be the drug absorption. This value will decrease as the rate of absorption is increases. Then last point of urine level data is XU infinity, means the cumulative amount of drug excreted in urine. And this XU infinitive is same like AUC of plasma data. There AUC was telling about the extent of drug absorption. Here also this XU infinitive will indicate about the extent of drug absorption. And this value will increase as the absorption also increases. So in plasma level data, Cmax, here it is dxu by dt max. In plasma level data, there is Tmax, here it is Tu max. In plasma level data, there is AUC and here it is XU infinitive. Then these are these two formulas for urine level data, same like your plasma level data. F is for absolute and FR for relative bioavailability. So here the formula also same like plasma data, only in place of AUC here we are writing XU infinitive. So F is equal to XU infinitive oral into dose IV divided by XU infinitive IV into dose oral. Similarly, the relative bioavailability XU infinitive test into dose reference divided by XU infinitive reference into dose test. It is very easy to remember. If you remember the plasma level data formula, this you can write easily. Just you have to replace AUC with XU infinitive. This is pharmacodynamic method or direct method. Here two subpoints are there: acute pharmacologic response and therapeutic response. So what will happen, sometimes the measurement of bioavailability by pharmacokinetic method is difficult, inaccurate and non-reproducible. That means in pharmacokinetic method we need to draw the blood sample and urine sample. But if the patient is a elderly person and if the patient is a infant, small kid, then from them taking blood and urine may not be easy. It is difficult. Similarly, sometimes the result which you are getting will be inaccurate and non-reproducible, means same data we will not get every time. With every test we will get different data. So it may be difficult, it may be inaccurate or it may be non-reproducible. So in those cases pharmacokinetic method will not be good. You have to use pharmacodynamic method. First one is acute pharmacological response. Here the drug response will be observed. The drug response like change in ECG, pupil diameter, heart rate and blood pressure will be observed. After the drug is given, how much response we are getting, that we need to see. Then how the bioavailability can be measured? It can be measured by the time curve and dose response curve. Means after the drug is given, with time how much response we are getting, that we need to plot, and that will help us in measurement of bioavailability. Second one is therapeutic or clinical response. So in this method, how much therapeutic response we are getting, that will be seen. This is not same like acute pharmacological response. Here in therapeutic response for a particular drug, we know a particular use is there. For anti-diabetic drug, it will reduce the blood sugar level. So that response only we will see. For the drug, there is a use. So that response only will be seen in this therapeutic response. Here we will observing the clinical response of a drug formulation to the patient suffering from the disease for which it is intended to be used. In case of anti-inflammatory drug, the how much the inflammation is reduced, that will be observed. So for what purpose the drug is used, that response only will be seen. How much it is decreased, accordingly we can measure the bioavailability. So this is therapeutic response. This was all about the measurement of bioavailability. Hope you have understood each point. If any doubts are there, please ask in the comment box. I will be definitely replying to your queries and questions. Hoping that you have liked this video. If yes, please subscribe to my channel and press the like button. This will motivate me to make more videos. Very soon I will come up with a new video in biopharmaceutics and pharmacokinetics. Till then, take care, stay healthy, stay safe. Bye bye.